Welcome back to another video, part of my primary care series. Today we're going to be talking about, could this be a sarcoma? Please take a moment to have a read of this disclaimer and pause the video. As always, my content is aimed for educational and informational purposes only. In this video we're going to look at the different types of sarcoma, what we need to look out for when taking a history and performing an examination, what are the roles of investigations in primary care, and what NICE suggests we need to look out for when thinking about could this be a sarcoma. So sarcomas can be classified into two different types, the majority being soft tissue sarcomas, with the rest being of the bone type. It can be hard to describe a non-specific symptom. In this case it could be a lump, it could be a swelling, it could be a change in the character of the skin, it might be something that the patient themselves have noticed, or it could be someone else. Either way, we need to gather a bit more information, more details about what's actually going on. Starting off with, obviously, when did it start, how long has it been there for, getting a bit of details about how it may or may not have changed, specifically focusing on size, the shape, how it may feel to them, what their perception of this swelling or lump might be, but also thinking about, is it painful? Unfortunately, it's not as clear-cut by saying, this lump or swelling is tender or painful, therefore this must be more concerning. Yes, I think it's a useful question to ask to help narrow down about what could be going on and potentially formulating a set of differentials, but the absence of pain does not necessarily mean that no further assessment is needed. We need to be particularly wary if pains are occurring at night, causing them to wake up from sleep or difficulties when sleeping, and also if there's limited response to analgesia, or in fact perhaps maybe pain relief used to work and now it doesn't. That might warrant you to prompt a few more questions to kind of gather what's changed. Instinctively you may ask about, was there any history of trauma or injury to the site that the patient may be concerned about? And you may also want to be gathering information about any other associated symptoms that I've listed here. I can appreciate that there can be a tendency to focus on the presenting complaint and gather details and examine the site of concern. However, it's important to also consider that there might be something else going on. There might be a sign elsewhere on the body that might help point towards what could be going on, whether that's an additional lump, whether there's a palpable lymph node, if there's any neurovascular changes, if there's organomegaly palpable on examination, when you're listening to the chest, is there any signs of a possible effusion? If you're able to consider these things, then obviously you can now start to gather a bit more detail about the area of concern, noting the size, the location, the shape of it, palpating and having a feel around the area. Is it mobile? Is there any skin changes? Is it tender? Does it move when you move the joint around the area of concern? Sometimes people find it useful to shine a torch to see if the lump or swelling transilluminates, and you might be able to also auscultate it and determine if the lump is of a vascular nature. Now, because we do see an increased incidence of bone tumours and sarcomas in younger patients, NICE has emphasised that you need to be able to recognise that we need to intervene, investigate, or even refer children more urgently than we would for an adult. Of course, it's still important. For adults, we tend to still stick with a 2-week wait rule or organising urgent investigations within 2 weeks. However, with children, there often needs to be a faster timeline, whether it's to organise a very urgent scan or directly contact the local paediatrics team to determine the next steps for assessment. So, in summary, an unexplained lump that increases in size, bony pain, bony tenderness, or a bony swelling, or any other clinical features that would make you concerned for a sarcoma, these would all warrant urgent assessment. Perhaps speak with your colleagues and reflect on previous cases where either an X-ray or ultrasound was suggestive of a sarcoma. Have a look at the characteristics that were described in the report that would prompt further assessment. And as always, take into consideration the age of the patient, where younger patients, especially children, need a very urgent referral. Whenever you get time, have a look and try and understand the referral form. Quite often it may ask you to clarify the site and the type of sarcoma that you're concerned about. It will highlight the age of the patient, whether they're an adult or child, and it will go through the specific criteria that would prompt you to use the referral form. And as always, you will probably or very likely need to attach imaging that has been performed that would support the referral process. For copyright reasons, I cannot attach the guidelines to these videos. However, I find it quite useful to refer back to these websites. To support your learning, please have a look at sarcoma.org.uk. It'll have a bit more information about the different types of sarcoma, understanding the risk factors, the epidemiology, but also a bit more information about your local sarcoma centre. It's also quite useful to have a look at the NICE guidelines specifically focused on, when do we have to suspect cancer, but looking at the subsection about sarcoma, all the things that we've talked about today, there's a bit more information in the link attached in the video description. And now that brings us to the end of this video on could this be a sarcoma, which naturally also introduces the discussion of what else could it be. Have a think and reflect on your assessment skills, discuss some previous cases with your trainer or colleagues, and hopefully brush up on your knowledge about sarcoma referrals. Please like and subscribe, and I hope you join me in my next video.